Galilee Center, Líderes Campesinas, TODEC, Pueblo Unido, and the Youth Leadership Institute. These organizations provided the foundation and the backbone of the collaborative, the Promotoras, who relentlessly canvassed the entire Coachella Valley, disseminating COVID-19 educational materials and providing logistical support at COVID-19 vaccination and testing clinics, something they continue to do to this day. At the same time the Coachella Valley Equity Collaborative was being established, we started conversations with growing Coachella Valley and its board members, who were concerned about the miscommunication and lack of guidance from all levels of government regarding the protection of farm workers and how to prevent possible outbreaks of the COVID-19 at their facilities and fields. I must admit, the first couple of meetings with them were very intense and emotionally charged because they were frustrated and couldn't understand why farm workers and food service workers were not initially classified as essential workers, which would put them in front of the line to get access to the COVID-19 vaccine. Ultimately, with pressure from growing Coachella Valley and support from elected officials and many community-based organizations, Riverside County included farm workers and food service workers in the first year of individuals eligible to receive the COVID-19 vaccine. However, access to the vaccine remained a problem due to the digital divide experienced by many farm workers. That problem was easily resolved when George Tudor, President and CEO of Tudor Ranch Incorporated, which you will hear from today, stepped up to the plate and granted us access to his facilities, which were the first in the nation to provide the COVID-19 vaccine to farm workers at their place of employment. Ultimately, national media coverage soon followed, along with the visit from Governor Newsom, who recommended this vaccination model to other counties in California with large farm worker communities. Other growing Coachella Valley's members opened their doors and allowed us to set up COVID-19 vaccination clinics at their packing houses, distribution centers, and agricultural fields. One of those members was Blaine Carrion, Vice President of Desert Fresh Incorporated and founding member of Growing Coachella Valley, who you also hear from today. He saw the potential and huge success these mobile vaccination clinics were having at reducing access barriers to healthcare services for farm workers, and he championed a $175,000 grant from the Coachella Valley Resource Conservation District, where he serves as Vice President. That grant, along with an additional $145,000 investment from the Desert Healthcare District, went to the purchase of the new medical mobile unit you're about to see and tour in a few minutes. To date, the Coachella Valley Equity Collaborative has provided more than 47,000 doses of the COVID-19 vaccine and more than 24,000 COVID-19 tests. All of this couldn't have been possible with the leadership and support from our community partners and amazing promotoras. Thank you.
So now,
on behalf of the Desert Healthcare District Board and staff, it's my privilege to welcome you all to this cutting ribbon ceremony. And we are presenting to you the Community Mobile Clinic. I will not list again all the elected officials and all the dignitaries we have here, but I do want to acknowledge something that has led us to this point today, which is Assemblymember Eduardo Garcia's work to expand the Desert Healthcare District. I want to offer a special thanks to the Coachella Valley Resource Conservation District for their generous contribution that Alejandro mentioned, and I want to acknowledge again your steward for your leadership and for making possible the services to farm workers. Your examples really led the way and opened many doors in the growers community to provide the services that they have received. Lastly, I want to thank Desert Regional Medical Center and Desert Physician Medical Group, Dr. Tay Kim and Gemma Kim, for your leadership and for that enthusiasm that you have shown to do the work and to provide the services and to take the services to where the people need those services. As I want to say that this mobile clinic was really the vision of our community. It was not something that we came up one day with and said, oh, let's have a mobile unit It was the community members that came to us as representative of the district and said, we want this community mobile clinic to bring services to people where they are, where they work, where they live, where they go to services, to churches, to every place we have in our community where we congregate people that have limited access to healthcare services. So, instrumental in crafting that vision and delivering that vision to us were the promotoras that have been working with us. So I want to thank you all, the promotoras that are here, and welcome you here. Very warmly. And very special thanks to the Purepecha community, because they not only have the vision, they gave us a prototype for that vision. So this was many months ago that we had the first prototype. They said that Alejandro and I are driving the mobile unit. We were able to have other people to drive the mobile clinic, but it was really very inspirational to receive this gift from the Purepecha community and from the promotoras. As your healthcare district, we have the responsibility to ensure that everyone has access to healthcare. Because the frailty of human life demands that we protect everyone's access to healthcare as a public good, as a right. I personally see healthcare access as a fundamental human right. It is a right to healthcare that is acceptable, that is timely, that it's affordable, and a right to receive a service that respects the dignity of human life, regardless of where you come from, regardless of the language that you speak, regardless of your wealth, regardless of your sexual orientation or preference, regardless of everything. So this fundamental social justice issue is because a healthcare injustice anywhere in the Coachella Valley is the risk of injustice everywhere in the Coachella Valley. Because COVID's shown us that one ill person can put everybody else in the Coachella Valley at risk. Now, we continue to depend on you. This is just a first step. We continue to rely on the wisdom, on the guidance of our community partners to tell us where to go, which communities to reach, and which people we need to serve. So we can build a stronger, better, bigger healthcare infrastructure for the Coachella Valley. And now I will give a brief summary in Spanish because I know we have some promotoras here that do not speak English as.
Please, your name, please, and your title, please.
Yes, I'm Dr. Luann Carlson.
Okay, tell me again your name and your title beside with this organization, please.
Okay, I'm Dr. Luann Carlson. I'm one of the associate program directors for our family medicine residency.
Hi, I'm Dr. Richard Henderson. I'm a faculty member for the family medicine residency, as well as lead for street medicine program.
Dr. Henderson, tell me a little bit about this new acquisition, about this drug that's going to bring medicine to the people, unfortunately people, mostly farm workers.
Well, we anticipate being able to increase our ability to reach the community, to, not just the homeless, but also to go out to various encampments as needed, depending upon what the needs are and as those opportunities arise.
Dr. Luann, what is there inside of this drug? What can they benefit? People, how can they benefit from this visit to those places?
Well, actually, this actually allows us to bring 2 exam rooms to the the community, so people don't have to come to us. We're going to have refrigerators. We can do vaccines. We can do just about anything that would encompass primary care.
Dr. Henderson, like how many people they're going to benefit? If, for example, are you going to travel every single day to the east part of the Coachella Valley, every week, every month? How is going to be the situation?
Well, this will be part of our community medicine rotation, and so we anticipate probably on a daily basis we'll be able to go to various sites, and we'll have a couple residents assigned to that rotation during that time.
Sorry for interrupting. It's going to be doctors inside the truck. How many doctors?
Yes.
Yes.
We should have at least one doctor, probably some of our nurses and nurse practitioners. We may have pharmacists with us. We also have the advantage of doing some telemedicine from this van, so we can bring in doctors who maybe aren't on the van with us.
What about medicines? You're going to give away medicines?
Yes, so it'll be kind of like a primary care clinic and a pharmacy rolled into one. Yeah.
I'm going to be excited for the people over there, and then you're going to be very busy traveling the whole coach. Are you going to be a travel?
Yes, I'll be part of it. I think all of us will be rotating on the truck.
You're not going to drive?
Oh, yeah, maybe. I'd look good in that.